Hello everyone, I am Dr. Shankar Dey. This is 12th video of my discussion NEET-PG recall session. So starting with question number 1 to 1. So very long clinical question was there. I have just pointed out the main clinical points so that we can revise all the 200 questions in very short time. So I have just point out the clinical clinchers or key points, but I will discuss the questions thoroughly as far as I remember or as far I recollect from my friends or national level faculties, etc. So don't. And another thing that I want to mention before discussion, I may be wrong after in this discussion, because even I don't know answer for some question. I have reviewed the question after returning from the exam center through different pages, national level faculties, books. So I may be wrong. If I am wrong, please do comment on the comment section. So I will try to rectify. So the first question, 1 to 1, the case of paronychia. One female patient, paronychia is what? It is infection of the nail bed. So nail bed infection, it is most commonly caused by which bacteria? Like Staph aureus or Streptococcus. This bacteria can, Staph or Strepto, can cause paronychia. Just 1 minute. Staph or Strepto. So these bacteria commonly cause paronychia, and following paronychia this type of skin lesions develops. So what is this? This is skin features of lymphangitis. So lymphangitis skin features was given. So this is paronychia and lymphangitis develops. So as you can see, the infection from the nail bed spreads to arm through lymphatic. So it is spreading type of infection. So it is most commonly streptococcal infection. And in NEET paper, what was the question that was asked? What is the management? So management for this patient, best management will be coamoxiclav for streptococcal infection. So coamoxiclav for lymphangitis following streptococcal paronychia. So answer will be coamoxiclav. So this is the answer for this question. So next, coming to question number 1 to 2. Very long clinical question was there, but main key points are thick skin on face. So this point is very important. Numbness, ANA test positive, anti-nuclear antibody test positive. One of the most important rheumatological disorder, nothing but systemic sclerosis. This numbness can occur, numbness in cold because of Raynaud's phenomena, sometimes cooling, change of temperature, change of color of the fingers can occur, Raynaud's phenomena. So this is nothing but systemic sclerosis. Two types can be there: diffuse systemic sclerosis, limited systemic sclerosis, or CREST syndrome. So you can learn the topic very well from your book rheumatology section. Coming to the next question, 1 2 3. Long question was there, definitely very long question, but clinical clinchers: upper limb hypertension, upper limb में hypertension, lower limb में pulse ही नहीं है, so pulse not present on lower limb. So this discrimination, upper high BP and low BP in the lower limb, definitely there is some abnormality in the arch of aorta. This is nothing but coarctation of aorta. So because of coarctation of aorta, blood flow is more in this region, in the in the proximal segment. In the distal segment, blood flow is very less, so less blood flow. That is why there is lower limb pulse not present or not palpable, upper limb hypertension, and exaggerated intercostal artery because of collaterals. So because of I think you know from your radiological knowledge very well. So because of this collaterals, there is inferior rib notching. I think you have seen the X-ray in your radiology class. Inferior rib notching sign. Next, this is 3 signs seen on X-ray. Then reverse 3 signs seen on esophageal barium study on esophagus. So these are various things you have to study from your pediatrics book or medicine book, radiology section. So study from different parts. Next, coming to question number 124. This was also clinical based question. Question was hypertensive patient, chest pain, unequal pulse, loss of consciousness based diagnosis. Actually, I have forgot the what was the actual question scenario, but I have but the answer was still remembered by me. That was TEO, transesophageal echo, because the patient was, I think, patient was fully conscious and clinically stable patient. So I think patient was stable in the question, and for the best diagnostic is transesophageal echo. So many things are there. It was very long question, but stable patient best diagnosis. I think this should be transesophageal echocardiography. Next, 85-year-old patient, nodules in the prostate, PSA 8, Gleason score 8. This is definitely prostate carcinoma. So prostate CA carcinoma management in this case is, I think, EBRT. I don't know. Please put on the comment section. Am I right or not? External beam radiotherapy. Other options are there like brachytherapy, surveillance, radical prostatectomy. Definitely, radical prostatectomy is not the management for the question that was given, but either EBRT or anything. So do tell me, but I think the answer is EBRT. Post-op analgesia and renal impairment patient, this is paracetamol. And another name of paracetamol was given, that is acetaminophen. I am discussing question based on my knowledge and knowledge given by faculties, lectures given by faculties after exam in their pages. So I may be wrong, please do correct. Just know the questions and possible answer. This is not the final answer. This may be possible answer. So headache improved after stopping analgesic. This was a clinical based question, clinical scenario based question, very long question. The question was, I think one female patient was there. She was taking some analgesic for his headache, but it relieved after taking medication. But after some days, even after taking medication, the headache was excruciating, and it stopped after. It improved after stopping analgesic, something like that. So question was, so what is the diagnosis that was asked? I think this is a case of medication overuse headache. This option was there, medication overuse headache. Next, question number 128, diabetic patient, pH 7.4. I think actually I have forgotten the actual ABG, but this ABG was there, but I remember there was alkalosis. There was alkalosis. pH was in alkaline. So definitely, and the question asked cause, I think one option was there, vomiting, multiple episode of vomiting in this clinical scenario based question, vomiting. So I think vomiting is the answer, because vomiting causes loss of gastric content, hypochloremic, hypokalemic, metabolic alkalosis. So I think this is the answer, but it was clinical scenario based question, and after excluding all the options, I have come to the diagnosis of vomiting, actually cause of this problem. Next one, this was also very long question, clinical scenario based question. Patient urine osmolality was there. Urine osmolality is very high, plasma osmolality very low. Just tell me the diagnosis by these two clinical keywords. Definitely, yes, you are right. This is SIADH, syndrome of inappropriate ADH hormone. ADH हार्मोन की वजह से ज्यादा वाटर का एब्जॉर्प्शन हो रहा है, इसीलिए प्लाज्मा में ऑस्मोलारिटी कम है, वाटर एब्जॉर्प्शन ज्यादा हो रहा है, तो यूरिन ऑस्मोलारिटी इज हाई और यूरिन इज गेटिंग कॉन्सेंट्रेटेड. दैट इज व्हाई it is SIADH. So possible finding among the options given in tomorrow's exam, possible finding is what? I think one of the option was there, hyponatremia. So hyponatremia. So I think this is the answer. Hyponatremia is seen in SIADH. SIADH. Next question. 138 patient. CD4 count very low. 55. Lower lobe opacity. Crackles present. These are the clinical features. It was very long questions. Crackles present, lower limb opacity present, X-ray. Definitely this is pneumonia. What type of pneumonia? By seeing one word, this CD4 count very low, you came to the diagnosis of pneumocystis jirovecii pneumonia, right? I know you came to the diagnosis of, but you are wrong. This is not pneumocystis jirovecii pneumonia, because in case of pneumocystis jirovecii pneumonia, not one particular lobe is involved. There is involvement of bilateral hilar region. That is why hilar opacity is seen in main cases. But this is lower lobe, only one lower lobe is involved, only fully developed lower lobe. This is lobar pneumonia, and this lobar pneumonia crackles is caused by streptococcus pneumonia. Maybe I am wrong, but I think this is the basics for this question. Examiner twisted this question so that you get wrong easily. So streptococcus pneumonia is the answer for this question. Okay. Next, question number 131. Congenital, a child with congenital hydrocephalus, CSF shunt operation was done a few days after birth. But now, after some years, after passing some years, again repair surgery of CSF shunt operation done. So repair surgery of CSF shunt operation. After 4 months of this repair surgery, the child is having fever, child became irritable. So what is the diagnosis? Definitely this is meningitis. This is meningitis following the surgery. So what will be the next best step? I think this is blood culture and CSF from the shunt tap. CSF collection from shunt tap. Another option was there, shunt tap. According to national level faculty, as they have put it in their social media platform, it is blood culture and CSF collection from shunt tap. Other options were like blood culture and CSF from lumbar puncture, wait and watch, shunt patency nuclear study. I think these are the options. So I think this is the options, blood culture and CSF collection from shunt tap. Next question was, this was also clinical questions, very long question, but I remember there was fatty streak on the bone marrow, there was no megakaryocyte, and retic counts is very low, and the patient was having like petechiae or gum bleeding, something. These options are weakness, petechiae, gum bleeding, some gum bleeding or something, bleeding episode history were there. So these were the history, and with this finding, this is a diagnosis of what? This is idiopathic aplastic anemia. So this is very straightforward, idiopathic aplastic, not myelodysplastic syndrome. This was very long question. Next, coming to the question number 133, a 60-year-old female. I think there was also history of hysterectomy few years ago. So 60 years female with history of hysterectomy, having abdominal pain, and then I think vomiting was also there, abdominal pain, vomiting, decreased bowel sound. These options were, I think, exaggerated bowel sound, I think option was there. So features of intestinal obstructions, option was there. Along with X-ray, there was features like multiple air fluid levels and air in the biliary tree region. So this is suggestive of gallstone ileus. So gallstone ileus is the diagnosis, I think. So gallstone ileus, this is actually components of regular stat. So small bowel obstruction, multiple air fluid level, and air in the biliary tree, pneumobilia. This is regular stat, and this is the diagnosis gallstone ileus. Next question was CVD stone was found in a patient up 2 years after cholecystectomy. So following 2 years of cholecystectomy, CVD stone was found. So the question asks, what is the type of stone? Actually, which stone, whenever stone found before 2 years, that is called retained stone, and when stone occurs after 2 years, that is called recurrent stone. But this is recurrent stone, but in the exam recurrent option was not there. There was retained stone, primary stone, secondary stone, or tertiary. These four options were there, I think. So the type of stone in this case, this is CVD stone definitely. So this is primary stone. Primary stone occurring 2 years after cholecystectomy. Next question, 135. So I think one IT software engineer or something, she used to have fast food all the time, no vegetables intake, and on blood examination pallor along with MCB 120 more than 110. So this is definitely macrocytic anemia, and the cause was asked macrocytic anemia. Both the option was given vitamin B12 and folic acid. This is controversial question because national level faculties are making controversy among themselves. Someone is telling it is vitamin B12 deficiency, some faculty is telling it is folic, but I think this is folic acid deficiency. I don't know. Please do comment for this question in the comment section. According to you, which is one is the diagnosis? Please do comment for the question. Everyone, I am requesting you do comment for this question. So, if according to me, animal products are good source of vitamin B12, and vegetables are poor source. So those who are mainly on vegetarian diets are more prone to develop vitamin B12 deficiency. But this champ is opposite, no vegetables, okay, and only fast food. So I think this is folic acid deficiency. I don't know why these national level faculties are making so much controversy among themselves. So according to me, it is folic. Let's do comment on the comment section. So cell affected in the MS. I have made this question into a one-liner question, but the question was not that much simple in the exam. It was a very long question. It was a long question in the exam. So the question was clinical scenario based. I think some symptoms of sensory loss or some sensory abnormality along with some eye features was there, optic neuritis features. So this is multiple sclerosis. The question was about multiple sclerosis, but multiple sclerosis was not told by the examiner. They have given a clinical scenario based question. So you have to arrive to a diagnosis of multiple sclerosis. Then the question was given, which cell is affected in this syndrome? Definitely in multiple sclerosis, myelin sheath forming cell. Which cell? Oligodendrocyte. So answer will be oligodendrocyte is affected. Oligodendrocyte. This is answer. Next, Pheochromocytoma. The question asks false statement about Pheochromocytoma. This is beta blocker given first. This is false. Propanolol given first is the wrong statement. Was the wrong statement because all of you know alpha blocker first followed by beta blocker. Opposite is not recommended. So alpha followed by beta. So beta blocker given first is the wrong answer. Next, a female patient after delivery never regained menses. So female patient delivery होने के बाद menstruation ही नहीं हुआ एक बार के लिए. So I know my Hindi is very bad because I am from Bengal, a Bengali. So I know Bengali very well. So একজন মহিলা পেশেন্ট যার ডেলিভারির পরে কোনো মেনস্ট্রুয়েশনই হয়নি, and there was failure, lactation failure, and there was history of multiple blood transfusion. So ডেলিভারির পরে যার মেন্সই হয়নি, যার মিল্ক প্রোডাকশন হয়নি, বা কোনো ग्रोथ हार्मोन डेफिशिएंसी, आई थिंक সেই অপশনটাও ছিল। सो ग्रोथ हार्मोन डेफिशिएंसी ये वाला ऑप्शन भी था। सो फीमेल पेशेंट डिलीवरी के बाद जिसका लैक्टेशन फेलियर एलोंग विद ग्रोथ डेफिशिएंसी का सिम्टम्स, ग्रोथ हार्मोन डेफिशिएंसी सिम्टम था और थी, डेफिनेटली दिस इज ए केस ऑफ Sheehan syndrome. So this is straightforward Sheehan. I know you are making fun of my Hindi language, but I am trying my best to improve my Hindi. So Sheehan syndrome. Sheehan syndrome. This is Sheehan syndrome. So varicose vein, one image was there. I have not found it on Google, so I don't know from where they have taken the image. So CEP classification asked, so please find out the image on the Google, then answer the question. Then question number 140, very long question, clinical scenario based question was there. History of night cough, wheezing, on chest x-ray miliary mottling was there. I think eosinophilia was also high in the option. This is presentation of tropical pulmonary eosinophilia. Tropical pulmonary eosinophilia. I may be wrong, but I think this is the answer. Tropical pulmonary eosinophilia. Very long question was there. So do subscribe the channel, Dr. Shankar Dey. In the next video, we are going to discuss question number 140 to 160. So next target is 141 to 160 question. So stay tuned for the next video. Thank you very much for watching.